Hello, everyone. Welcome to this episode of Surely Talk. I'm Mike Mulroney.
And I'm Kellye Duckworth.
Kelly, you a doctor?
Nope.
Nurse?
Nope.
Anything in the medical field?
Nope.
Yeah, not even a pharmacist?
No.
Yeah, me neither. So today's episode, as usual, we cover things and talk about things that we've researched on the internet. So if we say something, please get a hold of your doctor and make sure that it's true. But most of the research we do, we try to make sure it's fact-based. But luckily today, we have a special guest with us. We have Miss Dr. Knapp with us today from Norton Children's Hospital. How are you today, Dr. Knapp?
I'm doing great. Thank you. Glad to be here.
Yeah, thanks for coming in. And I see you, it says, Erica said you are a leukemia expert, so leukemia oncology. And we were very intrigued. Obviously, you work primary with kids since you're with the Children's Foundation. I didn't really follow cancer much until my mom got sick and passed away. And for years, I've heard people talk about leukemia, and I don't even personally know what leukemia is. So I was wondering if maybe you could kind of talk a little bit about leukemia, maybe some signs that somebody might have leukemia that they might be able to look for, something that might give people a little bit of education. Obviously, we don't want to freak people out and have symptoms and immediately think they have leukemia. So first question really is, what is leukemia and what are some signs maybe that somebody might want to be aware of?
Yeah, that's a great question. I do want to say that leukemia in children and cancer in children is relatively uncommon. So like you said, I don't want to freak people out or scare them, but I do think it's important to share some of the signs and symptoms that sometimes can clue us in that something wrong may be happening. To answer your question about what is leukemia, well, not to get too nerdy with you, but the origin of the word is based on Greek, and it literally means white blood cells in the blood causing a problem. And so what leukemia is a cancer of the blood, and some of the white blood cells essentially go rogue and start doing things they shouldn't be doing, and that causes a cancer of the blood. Ultimately, your blood cells are made in the bone marrow, and so really where the problem is starting is inside your bones, in your bone marrow. There's a soft substance inside of all of your bones, and that's what your bone marrow is. So if we're concerned about leukemia, that's where we will look inside your bone marrow. Some of the signs and symptoms in children that we might see, some of them are fairly non-specific. So things like being really tired, people might notice certain rashes or skin changes. Kids might be really pale. They might have these tiny little red dots called petechiae. They might have more bruising than usual, or bruises in unusual places, for example, on your stomach, on your back, as opposed to the more typical on your legs and arms kind of thing that you see with active kids. Kids might have fevers. They might complain of bone pain. So they might say their legs hurt, for example, or they might not want to walk as much. So some of these findings are what you might see with a child who has leukemia. Now, some of those things you might see in lots of other conditions. I mean, even a virus can cause a lot of those same issues. So sometimes it is hard to kind of piece apart the one kid in 100, say, who ends up actually having leukemia. But if you see anything like that in your child, or if you're worried at all, it's never a bad idea to talk to your pediatrician and go from there.
Is that usually where it starts? I mean, obviously, if the kid is sick, I have 3 kids and they're getting older. And since my mom passed, anytime they have a sniffle, I start. And I'd hate to consider myself a hypochondriac, but it's a worry. You want to protect your kids, and we see these kids with cancer, and it's absolutely horrible. But I guess it starts with the pediatrician. Are they looking for signs like that? Is it a blood test that might kind of help steer them in that direction and tell them what it is? How is it diagnosed other than visual stuff that you just mentioned?
Yeah, good question. A blood test is definitely a good way to start. And I would say, I have a lot of respect for general pediatricians general pediatricians, they have a very difficult job because they see so many kids, and most of the time, a kid with fever and not feeling great is going to be fine. Most of the time, it's going to be a virus or something along those lines. So it can be hard to know which is the kid that actually ends up having something serious. A blood test is often very helpful. We'll do a blood test called a CBC, which stands for complete blood count. And so what that does is it checks the number of white blood cells that you have, the number of red blood cells, which is a number called the hemoglobin. It checks the number of platelets that you have. And sometimes, I would say more often than not, a kid who ends up having leukemia sometimes will have a clue that the CBC is abnormal. Some of those numbers they can either be high or low. And especially if more than one number is abnormal, that can be a clue that we need to do more investigation. It is possible, though, to have a normal CBC and have that blood test be normal, but still have leukemia. That is possible. So if there's any doubt or if you want to look further, the next step would be doing that bone marrow test,
That's
which
what
is
I was
something
going
that.
to ask. Yeah, is that one, has that come a long way over the years? I've heard it historically it had been a pretty painful process, but that's a tell sign that it is leukemia.
Well, the bone marrow test would be the best way to know whether that's leukemia. Yeah. So if a kid comes into the emergency room, for example, or a pediatrician sends them to us, and we think leukemia might be something that we need to consider, that's often what we'll do next. And I'm glad you brought that up about, a lot of people get nervous when we talk to them about doing a bone marrow test, and they're nervous that no one wants to cause pain or suffering to their child. And people can already be sort of nervous about what's going on. And we do want to allay some of that fear and anxiety. We have a great team at the Norton Children's Cancer Institute, and we have a whole bunch of people, including child life and our child life specialists. Their job, a big part of their job is making sure children are comfortable and they get familiarized with medical procedures, and children get sort of told ahead of time what's going to happen in language that's appropriate for their age. So our child life specialists, they're really wonderful, and they really do such a good job in terms of translating the medicalization and all the terminology in a way that kids and families can understand and help them get through things. We're pediatricians, at heart, so I think we're pretty nice people, and we take a lot of steps to make sure kids are comfortable. Sometimes some of these procedures, such as the bone marrow biopsy, are done in adults while the adults are awake. But in children, we pretty much always do these procedures with sedation. So that's some type of, our anesthesia specialists will help give medication to put the child to sleep to a certain degree. And so the goal is not to have any sort of pain on the part of the child. We also give local medication that we inject kind of in the area where we're doing the procedure to help reduce pain. And afterwards, if there's any discomfort, we will always provide pain medication as needed. So I think telling parents that, hey, don't worry, you're going to be taken care of, your child's going to be put to sleep, you're going to be able to be with them until she goes to sleep, for example, I think that really helps people feel a lot better about what's going on.
Yeah, absolutely. And obviously we've came a long way because I didn't even know that. So just a bone marrow test, what's that involved? Do you have to like drill into the bone? I mean, I'm just curious. I've always wondered how that happens. Do you have a special device that taps into so do you have to get into the center of the bone? Is that what you're looking for?
Great question. Yeah. So we are looking to get past the hard layer on the outside of your bone and inside to the spongy part, which is where the bone marrow is. There is a drill version. We don't tend to use it a lot here. I don't think it's used a lot in pediatrics, period. It's designed more for adults. So it's basically a decent size needle. And
Okay.
once the patient is asleep and once we've numbed the area, then we usually will, the most common spot that we do these procedures in is the hip bone, because that's a nice, big, strong bone, basically. And so the patient will often be on their side, and we'll take this needle and put it into the skin, and we'll get into the hip bone, and we get far enough into the bone that we're in the right spot, and then we'll take a sample from inside the bone.
So you're not actually cutting the patient open. I'm thinking of a spinal tap type thing. I don't know any of this, obviously. That's why I'm asking. But so you're actually taking a needle, inserting it in. So if someone has leukemia, it will be all through all their bone marrow, I guess, or certain spots, or it's all through the body.
That's another great question, actually. So if it's truly leukemia, then most of the time, no matter what bone we pick or no matter what spot we pick, we should be able to detect it with this bone marrow test. Um, However, with certain other cancers, for example, lymphoma or other types of cancer, it is possible sometimes to have the cancer be in certain parts of the bone marrow, but not all parts, if that kind of makes sense. So it really
Right.
depends where you choose to do the test. So sometimes in those patients where we think, oh, this might be lymphoma, or we need to look in more than one place, we'll actually do more than one spot
Well,
in one time.
since we're on the bone marrow topic,
Yeah.
I know bone marrow transplants, is that kind of like a last ditch effort? Or is that most leukemia patients end up getting a transplant at some point?
That is an excellent question. And that's something that I think a lot of people, when we talk about bone marrow transplant, a lot of people get sort of, that means different things to different people. And some people get nervous about it, or some parents will ask about that right off the bat. And yeah, it's a great question. I actually have specialized training in pediatric bone marrow transplantation. So, in addition to leukemia, that's one of my areas of interest and expertise. Um, and the goal really is for most children with leukemia, they will not need a bone marrow transplant, and that's what we tell people generally from the beginning, especially if they have questions. So we like to sort of explain what the planned treatment is. As soon as we have a confirmed diagnosis, we'll talk to the family about, okay, here's what we're planning to do, but also here's what we're not planning to do. So I would say it is most children with leukemia will not end up needing a bone marrow transplant. It's often reserved for when the leukemia comes back, or if it's harder to treat than we had initially realized, for example, or certain types of leukemia that we know don't have a great prognosis. In those types of situations, we'll consider that.
Okay, so then most of the time you're still doing the chemotherapy and radiation and things like a normal cancer, I guess.
Right. Most of the time, I would say for if a child has leukemia, then the treatment generally includes chemotherapy. And there's lots of different ways to do chemotherapy. Sometimes we give chemotherapy in the blood, either through an IV or a special kind of catheter that goes into one of your blood vessels. Um, Sometimes we'll give chemotherapy into the spinal fluid, doing a spinal tap, like you mentioned earlier. Um, and sometimes we give oral chemotherapy, pills or liquids that patients can take at home, which is sometimes, a lot easier. You don't need to be in the hospital or in the clinic or infusion center for that. The radiation part, that's also something that I would say most children with leukemia don't end up needing radiation. We have a wonderful set of radiation oncology physicians and other members of the radiation oncology team. They're really great with children. Everyone who meets with them is pleased. And so if we think a child may need radiation or will need radiation, we'll have them meet with that team. But in most cases, where we are able to avoid radiation.
Okay.
Yeah, because that's obviously it's all hard on the body, but radiation is pretty brutal. I've seen burn marks and stuff, and I guess it's kind of a last resort if chemo doesn't work.
Yeah, it depends on the individual scenario, but you're absolutely right that especially when you're talking about treating children for cancer, we've made a lot of progress over the past few decades. Of course, we're always striving to make more progress, and some of the things that people are focusing on nowadays is, especially for the types of cancer that say have become more treatable. We as a community are looking at things like, well, how can we reduce side effects from things like radiation. So over the years, there's been a lot of progress made in terms of fewer kids getting radiation, for example. We've learned how to still have good outcomes and good cure rates, but not give quite as many children radiation, because it absolutely does have side effects, like you mentioned. Some children, not necessarily, I'm not necessarily speaking only about leukemia, but some children who, for example, may need radiation to the brain, that is an important part of treatment in some cases. But as you can probably imagine, taking a young child and giving radiation to their brain, that can have implications on their brain development, for example. And so their vision, there's lots of things to consider. So yeah, it is definitely a delicate balance in terms of how do we treat your cancer the best way we are able to and give you the best treatment that we have, but also hopefully, a lot of these children we hope will go on, and most of, I would say a number of them do go on to beat the cancer and live long, productive lives. And so there's a lot of focus on what we call survivorship and what are the side effects from the treatment and how does that affect children? Hopefully they're going to live to be really old. So we have to think about those things when we're deciding on treatment. How do we ensure that we beat the cancer, but also make you as healthy as possible for the rest of your life? So that
Right.
there's a lot to consider there.
Yeah, because being a young person, it's easy. I'd say easy, but I mean, as you're applying treatment to keep other organs in mind and reproduction as a kid and how it affects them long term. And I guess it's probably things that people just don't think about when they think about cancer, and especially kids. But if it gets to the point of a bone marrow transplant, and everybody hears bone marrow transplant, but I'd say 99.9% of the people have no idea what that means. What goes on with a bone marrow transplant? Are you injecting new blood into the bone marrow that circulates through the body, or how does that? I don't even know what that means or how it works.
Yeah, no problem. Yeah, I would say a lot of people have an idea of what a bone marrow transplant is. That sometimes is not exactly what it actually is. So yeah, I'm happy to discuss that. So a bone marrow, maybe I should start by saying a bone marrow transplant is not a surgery. A lot of people get nervous and think that it involves some sort of, surgery or cutting somebody open, but really what it
What I
is.
thought. I thought that
Okay,
originally.
yeah, no,
Yeah, I had no clue, so that's why I asked.
don't worry, you are not the only one.
Yeah.
Um, so if you are receiving a bone marrow transplant, basically there's two types of bone marrow transplant. Um, and the type that we more commonly think of when we think of a bone marrow transplant is basically we are replacing your bone marrow with somebody else's, if that kind of makes sense.
But is
Um,
bone marrow kind of a soft tissue inside the bone, or is it the blood inside the bone?
that's a great question. Really, what we're trying to replace is the cells inside the bone marrow that
Okay.
make blood cells.
Okay.
They're not mature blood cells necessarily. That's not what we're looking for. They're stem cells. So some people, maybe a more accurate term that people use more nowadays is hematopoietic stem cell transplant. Now that's a mouthful, so I think bone marrow transplant, that's still part of the sort of lay language. But if you want to be super accurate about what exactly you're doing, it's stem cells that you're transplanting. So it's those cells that can turn into blood cells and that can turn into an immune system. That's what you're trying to replace.
Got it. But you have to find it. I guess it's if you get a blood transfusion, you have to find blood that matches yours. Is that the same thing with the stem cells? I guess the stem cells typically come from like a sibling or somebody else that you remove and then inject into the patient.
Yeah, so that is a great question as well. Gosh, you guys have lots of great questions.
This is we love. I mean, I got thousands of questions. We could keep you here all day, but it's one of our goals with the Shirley Talk is to educate people on different cancers and how it works. And I mean, these things of
Mhm.
I've had these questions for years, and I've never known anybody to ask. So thank you for taking the time
Right.
to answer these today.
Oh, sure. And I just want to encourage everyone who's listening. Please, we love when parents and families and patients ask questions. Please don't feel like this is a dumb question because it's almost always something that other people are wondering too. And we do not expect people to know any of this. And, sometimes we doctors honestly forget how to speak normal English, and we forget what
Yeah.
a normal non-medical person knows and doesn't know. So sometimes you have to remind us, hey, wait, can you go back and explain what exactly that is?
Yeah. My day
So
job is in IT, so we get that all the time. Can you say that in English when we're talking about the networks and all that? So no, I totally get what you're saying, but so yeah, it's the layman's terms is what people are looking for, so they can kind of understand it. But it's so intriguing that you are able to do this stuff. It's just crazy with the body.
it is amazing. I mean, I think the human body is amazing. The immune system, the way we can manipulate someone's own body and immune system and change things and use your own immune system to fight cancer. That's a new sort of area within cancer research that's pretty exciting. So yeah, I mean, to answer your question about whose cells are we giving to the patient, whose cells are we replacing your bone marrow with? And it's a complicated question, and a lot of time and effort is spent by us and others in making that decision. You mentioned a sibling. In a lot of situations, yes, a sibling can be the best. If we have a sibling who is a match, and I can explain what that is, then that's often our sort of first choice. But you can have a full sibling. It does generally need to be a full sibling to be a full match. But you can have a full sibling. You can have multiple full siblings, none of whom are an appropriate genetic match. Basically, there's certain. It's separate from blood type, but it's a similar concept, kind of to your point. So the blood type doesn't matter quite as much, but there are certain genes that basically have to do with the immune system. And if you and your donor are similar in terms of these genes that we know are important, ideally you'd be similar in all those genes, then there's a higher chance that the transplant is going to go well and things are going to go well and you're going to have fewer complications. So we always look for someone who's what we call a full match. Or historically anyway, that's been sort of our top choice. And if there is a sibling who's a full match, great. If not, there are still other options, including volunteers. There's an international registry, which I encourage everybody to sign up for. It's called the NMDP, National Marrow Donor Program. And basically, they have a whole list of people all over the world who have given a DNA sample and have volunteered. Potentially, you're not committing to anything by sending a sample. I want to make that part clear too. But if a kid or an adult or someone ends up needing a bone marrow transplant and they go through the computer and find out, oh, hey, you're potentially a good match for this patient, then they'll call you up and say, hey, would you be willing to donate stem cells, basically. So that's pretty cool.
So can it come from a parent? So if a child has leukemia, are those cells too old? And I mean, and I say that in a nice way, but is it typically
Right.
or somebody of age, the same age as the kid, or is the parent able to do that?
That is another excellent question.
Age specific.
Yeah. So age does matter. Absolutely.
Okay.
Probably our ideal would be a young, healthy, say young adult in their late teens, early 20s, something like that. Because of issues relating to the immune system, ideally, if the donor is a female, they would have never been pregnant before, because that can sort of alter the immune system and can sometimes lead to an increased risk of complications. So yeah, when there is a sibling, especially for a child, if that sibling is a healthy young-ish person, that's really an ideal scenario. If you're past, I mean, not that these people are old, because I would include myself in this category too, but if you're past 35, then you're probably not our ideal age in some ways.
So
But
I'm out and Kellye's in.
Sorry to break it to you.
Yeah, I'm out and Kellye's in. So you need to get on the donation thing today. So
Yeah.
So when you have a bone marrow donor, Are they going through the same thing? I guess you're going into their bone and taking cells. Is it as pain? Because I hear people say, "I'd love to be a donor, but I heard it's really painful." I mean, well,
Mm-hmm.
that's one, that's kind of selfish, and two, if you're able. But it doesn't. If you donate bone marrow, it's not like donating a kidney. You're not getting rid of something that you're going to do without. You're basically taking some of your cells and giving
Mm-hmm.
them to the. So you could. Can you be a couple questions here? Can you donate bone marrow more than once? And if so, is it very intrusive for that person, or is they just need to suck it up and donate the bone marrow and realize they're doing it for the good, I guess. Uh,
Right.
yeah.
Yeah. Yeah, a lot of people get sort of nervous because of concerns like that, and I definitely want to set the record straight about what it means to be a bone marrow donor. To answer your previous question, because it really was a good one, can parents be donors? Absolutely. That's becoming a more and more common thing, especially say you don't have a sibling who's a great match, and maybe we haven't been able to find an ideal donor in terms of someone off this registry, a volunteer, unrelated donor, we call it. Um, so so sometimes a parent can be a good option, even though they're old or older can be. That's okay. We'll let things slide a little bit. But that's a relatively newer type of transplant, and we call those people haploidentical, which basically means a parent is most likely going to be a half match to the kid genetically, which makes sense because simplifying things, you get half your genes from your mom and half from your dad.
Makes
So
sense. Yeah.
it's nice to have that option that, yes, oftentimes parents can be used as donors. And it doesn't even have to be a parent, it could be a sibling, it could be a grandparent. I've seen all those types of scenarios, or another relative. So it's nice that we are able to do more these days in terms of donors, because finding a good donor really can be a challenge for a lot of patients. And we don't want to tell anyone, hey, you need a transplant, but we can't do it because we don't have a good donor. So that's really the goal. Um, and one more sort of point to make on that subject, depending on this, I find this really interesting. Depending on the racial and ethnic background of the patient, that can sometimes impact your chances of finding an appropriate donor, especially in this registry of all these volunteers, these potential volunteers. So if you're Caucasian, statistically speaking, you have a better chance of finding someone who's genetically matched to you such that they could be your donor. But if you're a racial minority, or you're of mixed racial background, like me, for example, then sometimes that means your chances can be lower. So that's why it's, I think, particularly important to expand our potential donor pool, get people to register for this program and sign up to be potential volunteers, so we can make sure that every patient, kid or adult, who needs a donor can find one. I think that's really important.
So do you have
Um,
to have the genes or the stem cells, the bone marrow from someone of like race, or does that matter?
no, it doesn't have to be from the same race, but it's just statistically more likely to find it. They need to be genetically matched to
Yeah.
you in terms of
Yeah.
certain genes.
Yeah.
So statistically, sometimes it's easier if someone has a similar racial background, but sometimes, yeah, the donor can certainly be of a different race, and that part doesn't matter medically.
Statistically, it's a better match if it is, I guess, is what you're saying. So
You're just, yeah, a Caucasian patient, for example, is more likely to find a donor who is probably going to be Caucasian, but also, yeah, all sorts of things happen.
So as far as the person donating the bone marrow, is just it's not as invasive as people think it is. You're injecting the
Right.
needle in their bone marrow, and they're sedated to some point till they're not going to be in excruciating pain. I mean, it's not a horrible, painful process,
Right.
probably like it used to be. I guess.
Right. Yeah, you're asking so many good questions. I feel like I'm struggling to keep up with all the good
Sorry
questions. I'm
about
always
that.
one
Yeah.
behind. No, they're I do think this is an important point to make. So yeah, if you end up being a donor for a patient or a potential donor, one of the things that they'll ask you first off is whether you'd be willing to donate bone marrow. And I can explain that procedure in a minute. It is similar to the bone marrow biopsy procedure that we were just talking about. Um, But there's also a newer technique where actually all they have to do is collect your blood. They don't even need to get inside your bones at all. And sometimes that can be a good option as well. Basically, what happens is you get certain medications ahead of time, and then they hook you up to this special machine. And this special machine knows how it'll take out your blood, and it'll take out the cells, the special stem cells that we want, and put everything else back, which is pretty amazing. And you would be on that machine for a few hours, basically.
That is
Um,
amazing because the reason I asked that is I've heard people, again, making up rumors or whatever, but I'd love to be, but it's so invasive and I can't afford to miss work. So you're saying it could only take a few hours, maybe a day of your time to help save somebody's life.
right, right, exactly, exactly. Can you all still hear me?
Yep.
Yep.
Okay, I'm sorry. I think my earphones are running lower quicker than I thought. These are new, and I'm still getting used to them.
Nope, loud and clear. So
Okay,
yeah,
good.
again, the bone marrow donor isn't as intrusive as it used to be, which is a good thing.
Right. I mean, in some cases, we will still use the older technique of actually getting stem cells from inside the bone. And usually, what would happen there is the donor would be put to sleep, and you'd get lots of numbing medication, and we would go into your hip bone, usually on both sides, and put a needle in and take out stem cells. And we do that many times, sometimes even over 100 times, but you're asleep for the whole thing. You're under general anesthesia. You don't feel anything. And then sometimes when people wake up, they can be a little bit sore, but again, you get plenty of pain medication. And oftentimes people, they leave that same day. They can potentially go back to work the next day. It's really not as bad as you might think.
I'm signing you up to be a bone marrow this afternoon.
Okay.
So, I mean, it's so interesting, all this stuff, and it's amazing what you're able to do. Is there any new treatments coming out that you might be a know of or that you could speak to that might be helpful, or you're seeing some pretty good signs that is really changing childhood leukemia cancer?
That's a great question. There's lots of new treatments on the horizon for leukemia and other types of cancer in children. One type of new treatment that has gotten a lot of press with good reason is called, there's sort of a broader category of immunotherapy. Basically, we're thinking of all sorts of ways to the immune system. Again, it's such an amazing thing. I realize I sound pretty nerdy talking about this, but it really is just the way our immune systems are designed. There's so many intricate parts, and some people have thought, how can we take the immune system and all the amazing things it can do, and how can we harness that to treat cancer better? And so there's one type of treatment where we can take a person's own T cells, that's part of your immune system, and
Right.
basically you take them out of the patient, and using a special machine, kind of like what I just described for the donors. So this special machine will take out the T cells that we want from the blood, and then you take the T cells into a lab and you teach them how to fight cancer, and then you put them back into the patient, and they find leukemia cells and kill them. It's pretty
Wow.
amazing.
Oh my
Yeah,
goodness.
that's incredible. How long? I mean, obviously they've been working on that for many years, but those type of things where you're having your body actually fight it versus putting medicine in your body to treat it sounds so much better in most cases. So that's amazing that they're working on something like that. Or is it in trial? Is it being used right now?
So it is being used. There are certain forms of this treatment that are commercially available, approved by the FDA. Yeah, absolutely. I would say we're still learning what types of patients to use these in. And, I think a few years ago, it was only patients who had bad leukemia that had come back, for example. And I think now we're sort of looking at using it earlier and earlier for patients. And, one day will we be in a place where people will get less of the chemotherapy with the side effects that the chemotherapy has and have more of these types of treatments? Potentially. Not that the newer treatments have zero side effects. I think that would be inaccurate, but the hope is that we can sort of reduce the overall side effects that people have with leukemia treatment and cancer treatment in general. Yes.
I've read some about that, but I really didn't understand exactly how they were doing it. So they're teaching you're teaching your cells how to fight the disease, and then injecting them back in the body, and they kind of spread the love. They go through your body and train all the other cells how to do what they just learned, I guess, in a simple form.
You basically have your own T cells attacking only a particular type of cell within
Okay,
your
so it's not
body.
training the other cells in your body how to do it. It's going in and taking over.
Essentially,
Yeah,
right.
yeah,
Yes. Hmm.
that's pretty amazing.
Well, I have sort of more of like a personal question for you. I know most doctors or people in the medical field kind of have a calling or some reason kind of why they chose to do what they do. But your specialty, I mean, was there something that just made you want to do pediatric oncology or?
Great question. Yeah, I don't. A lot of people that I've met in the field, some of the best doctors and other sort of professionals that I've met have some amazing story where they had cancer as a child,
Right.
and this is their way of contributing and being part of the community. I don't have anything quite that dramatic, but
Hmm.
I've met, I've been privileged to meet so many amazing people along the way. And I will say that when I was in medical school, still deciding what to do, I met um, a young adult, really. I mean, he wasn't a kid. And he had, unfortunately, a very bad type of cancer, and it had relapsed a few times, and his prognosis was really not very good. Um, and he taught me a lot. If sometimes there isn't always a happy ending, but he was so mature. And I remember specifically, it's kind of an interesting story, but basically he and his father got into a disagreement with the doctors about what the best treatment would be. Everyone wanted to help him. I mean, everyone had that goal in mind, but they had different ideas about how to make that happen. Long story short, and it turned into kind of a heated moment. And I remember I was just a medical student. I felt so nervous, and I was trying to just hide in the corner of the room, honestly. And he looked at me. There was sort of a break in the proceedings, and I was doing my best to blend into the wall, but he said, "Oh, tell me your story. You're a med student. Well, are you learning anything? Your job is to learn, right? You're a student. So tell me, are you learning anything today?" And I told him I was pretty nervous to even talk to him, but I said to him, I feel like I'm learning a lot today. I can't even articulate what it is right now. And I'm a little bit scared of the conflict and people yelling at each other, and people disagreeing, and some of that was, it's difficult, I think, to realize
Hmm.
that's part of what we do, honestly, that sometimes there is conflict and sometimes there are disagreements. um, but but I think I did learn a lot from that patient and from his family and from that whole encounter. And I think that it's really important to recognize where other people are coming from. And sometimes
Hmm.
sometimes it's not easy, but we have to think about, well, we all want the same thing. How do we get there? And how can we compromise so that, everyone's happy with what we're trying to do?
Right.
So did that steer you in the direction when you decided you wanted to go to medical school? So being in childhood cancer, was that your goal, or was you looking to do something else and then kind of had a heart for it? Or how did you end up working with kids?
Well, I think I knew fairly early on that I preferred kids to adults. Um, kids are pretty amazing, and sometimes people think, oh, cancer in children, isn't that depressing? It's really not. I think it depends on your perspective, but um, with kids, I think oftentimes kids are amazing people. They can handle things so much better than adults.
I agree with you. Yeah.
We're wimps, these kids are so tough. um, and it's really amazing when you look at how much they can handle and how they can, keep a positive attitude. I'm not saying there aren't really rough times, and there are, and sometimes that can be really heartbreaking to see kids and their families go through hard times. But I think it makes the work even more important when the stakes are so high. And so, everyone, it's nice to have everyone really united in a single goal.
Yeah. Yeah. Well, it's amazing what you all do and the
Hmm.
treatments that you all are coming up with. And does Norton's actually participate in I know y'all do trials, but like the science of it is, I don't know how that works. Obviously, somebody's creating these medicines. Do you all help them participate in creating some of these things, or is it just something that you all take on after it's created? The
Yeah,
treatment.
absolutely. Yeah, that's a great question. We have lots of research going on in many different capacities at Norton Children's Cancer Institute, clinical trials, but also some of our oncology doctors are discovering new treatments and trying them out, in people, or maybe initially in the lab and then in people. And so we've got a lot of exciting stuff going on there that's led by some of our oncology doctors.
That's amazing. Well, Dr. Nat, thank you so much for your time today. We really appreciate you spending time. It was so educational for me, and I'm sure, Kellye, you obviously.
Well, like you said, we could keep her here all day, but
yeah, because you hear these things all the time, and I would say most people don't know what they are. The TAPS and the bone marrow and all that thing. So thank you so much for answering our 1,000 questions today.
Is there anything that you would like to add that we maybe didn't touch on?
Well, I mean, thank you guys for having me, and I would say we're always available. Pediatricians call us all the time if they have questions. So if there's any concerned parents out there who, want to run something by an oncologist, we're always around. People call us all the time. We're happy to answer your questions, and hopefully we never have to meet you or your child. But if we can alleviate some of that, if it helps you to meet with us and just talk about things, we're always available.
That's good to know.
Well, thank you so much for your time. We greatly appreciate it. And yeah, we have your number now, so we're going to call you.
Uh-oh, should I be nervous?
I'm just kidding. We would never do that. Well, thank you so much. We appreciate it. Kellye, how can people support what we're trying to do with Shirley's Way?
Well, we would love to add you all to our donor list. So 2021, we're pushing really hard for $1,010 monthly donors. So if you have it in your account, $10 a month really isn't a lot. You probably won't even miss it, but $120 a year, that's someone's utility bill, and it, food on their table or their co-pays or whatever it may be. So please consider.
Can you still hear us?
Yeah, I think my earbuds tapped out.
Oh, that's okay. We can hear you. Thank you so much for your time today. Amazing discussion. So many things that people don't know and don't know how to ask. So we was trying to cover a lot of those today. So we really appreciate your time.
Yeah, absolutely. No, this was such a pleasure meeting with you all. And it's nice to know you all are local. And thanks for sort of keeping us and our kids as part of your, fundraising efforts and advocacy. And I know we and our patients really appreciate it.
We're trying to do the best we can. It's hard to raise money, but we do a lot of raffles and gaming and giveaways, but we try to do what it is that people enjoy to participate in. And then we're doing, all the streams and YouTube and podcast for educational purposes. So I think people are going to be very enlightened to hear what you covered with us today. So thank you. I see Erica just popped back up. Can you hear us?
Yes, I can. Thank you all so much, Mike. Great questions, both of you. Dr. Knapp, you did a fabulous job, wonderful job breaking it down into layman's terms. I learned a lot today. Thank you for the opportunity. We really appreciate this, and we hope that this will help someone who tunes in. Do you know when we can look for this or where it will be posted?
Andrew?
Yeah, we can. I don't think we have any episodes with guests ahead of this one, so we could really just fast track it for this coming Monday if you'd like.
Yeah, that'd be perfect. If you all are okay with that, the episodes release every Monday, so we can push yours out this coming Monday if that works out for you.
Awesome. Cool. I look forward to that. And where do we look for it? Is it posted on your website? Is there a link, or do we have to download an app?
So the Shirley Talk podcast is available on Apple, Spotify, and Google platforms. And they also have essentially a landing page for the podcast as well on Sounder FM. I will reshare that link with Mike and Kellye, and they can send that to you all directly. But it should be pretty easy to find on Apple, Spotify, and Google as well.
Yeah, we'll try and send you a link so you have it for
Awesome.
Real quick before we go, just keep in mind if anybody else at Norton's wants to be part of this, we'd love. I know there's a couple kids that have been fighting. I can't think of the term, but basically it's brain cancer.
I think it's the
DIPG or something like that. We'd love to
tumor.
talk to somebody about that one day if you have someone that would be willing to speak to that as well.
Sure. Yeah.
Have you talked to David Jr.'s mother?
I've talked to her several times, and I know he died last week. So
I figured, sadly, I know his mother was just very, very passionate about sharing his journey and spreading awareness. So I figured maybe that's why you mentioned that.
Yeah, I mean, again, it seems like those are the two primary cancers that kids get. Is that correct, Dr. Knapp? Is leukemia and brain cancer, and I don't typically hear anything else on my side, obviously, but.
Well, I think it depends on how you classify things, but yeah, if you put all brain tumors together, that especially in Kentucky, that is a pretty sizable piece of the pie. We actually, I mean, I'm sure either of our neuro-oncologists or both of them, Dr. Mikey Wong and Dr. Mustafa Barber, would be happy to talk more about it. But brain cancer is actually more common basically in Kentucky than in other parts of the country, which is really interesting. And
I wonder why.
Study. So it is something that's really important, especially in our state.
Yeah, we'd love to talk to somebody about that one day if maybe we can make that happen as well. And it's all the more, I love Kentucky, but you just kind of solidified I need to move to Florida or someplace that's that's horrible to say. I have heard cancer rates in Kentucky are higher, but I didn't know brain cancer rates were higher in here than most places.
Based on limited data, but yeah, it does appear to be that way for children in particular.
Yeah.
Erica, I had a quick question for you if you have a second. Are you just PR for like Norton Children's, or do you have connections with like the NCI unit downtown, or is that a separate PR?
Yeah, so I handle public relations for all of cancer, but just for simplicity matters, if you all have any PR questions, if you just want to reach out to me, feel free to do that. We have 4 members, or 4 people, I should say, on our PR team. And what we do, just because Norton Healthcare offers so many services, we split up our duties among different service lines, is what we call them. And that's basically just different departments. For example, I handle cancer and any foundation events. Some of my colleagues handle neuro and just different areas. And when I say neuro, I mean neurology. So for simplicity reasons, if you would like to just shoot me an email if you guys have any requests, I'm happy to help coordinate and get you set up.
Yep, sounds good.
Thank you all for your time today. Nice finally meeting you all, putting a name to an email or a face to an email, voice to an email, however. And Dr. Knapp, thank you so much for your time. I know you're busy, but we appreciate you taking the time to talk to us today.
So nice to meet you all.
Thank you.
Bye-bye.
Bye.